Sophia Amida is looking at her fetus for the first time at this clinic in Kenya's Mukuru kwa Ruben slum. Amida is due in a few weeks. She says getting an ultrasound is critical for her because her first baby was delivered by cesarean section.
They could not tell how the baby was positioned. At the time of my delivery, the baby was still way up and was not moving down at all, so I had to go for surgery.
For most women in Kenyan slums, often called informal settlements, this type of medical technology is out of reach. One session can cost as much as $60. But with a relatively new ultrasound device called a butterfly probe, patients like Amida can get an ultrasound for just $10. The device is designed by the US-based health tech company Butterfly Network. The probe can connect to a tablet or a mobile phone, making it portable and easy to use for sonographers like Alfred Kibet.
It enables you to reduce the cost of doing ultrasound, because you see with the other traditional machines, ultrasound machines, they are quite expensive, and again the other components involved, like you need a printer, a special printer. And so, but with this, you can just store the images and then you can print with a regular printer.
Healthcare companies like Access Afya are partnering to provide the devices to clinics, especially in densely populated areas. The goal is to close the gap of affordable healthcare, says Access Afya's finance director, Danny McCabe.
They don't need to be focused on how do I get a payback immediately on this machine, and be focused on, hey, how do I make the highest price possible for these machines? You can be focused on providing the best level of care and then working with us to make sure there's enough foot traffic here to make sure that at the end of the day, everyone's able to make their money back on the machine.
Kenya has among the world's highest rates of maternal deaths according to UN figures. Nurse midwife Millie Karina says ultrasounds can help to detect and avert most difficulties at birth, like when a woman is carrying twins.
Sometimes I've found that we're in labor with a mom, but we didn't know there were two. We thought it was one, but there are two. So that can complicate things a little bit for the mom, not knowing. Number two, mothers have lost pregnancies because the placenta was insufficient. And something that could have been picked up really early, but unfortunately, it happens.
Kenyan healthcare providers believe that lower costs of medical technologies like ultrasound will help to lower infant and maternal death. Victoria Amunga, VOA News, Nairobi.